Diarrhea is defined as a passage of 3 or more loose or liquid stools per day, or more frequent passage that is normal for the individual. Frequent passing of formed stools is not diarrhea, nor is the passing of loose, pasty stools by breastfed babies. According to a World Health Organization report, diarrhea disease is the third leading cause of death in children under 5 years old and is responsible for killing around 443,832 children every year and an additional 50,851 children aged 5 to 9 years. Diarrhea can last several days and can leave the body without the water and salts that are necessary for survival. It mostly results from contaminated food and water sources. Worldwide, 780 million individuals lack access to improved drinking water, and 2.5 billion lack improved sanitation. Diarrhea due to infection is widespread throughout developing countries, unfortunately. A significant proportion of diarrhea disease can be prevented through safe drinking water and adequate sanitation and hygiene. Stay tuned on your regular Health TV Talk Show The Physicians as we discuss diarrhea in children, the causes, management, complications, and prevention. Welcome to your favorite Health TV Talk Show, The Physicians, where your health is our business. Today we're discussing diarrhea in children. The causes, the prevention, the risk, the management. And in the studio to do justice to this topic is Dr. Maalikah Timson. She is a general practitioner with the sick bay of Naval Doctrine Command, Bonny Camp. Doctor, you're welcome to our program.
Thank you very much.
Welcome, Dr. Timson.
Thank you.
It's always a pleasure having you on board.
It's very pleasant smile, as usual. Okay, so we're talking about diarrhea in children, okay? And we know that it's the third leading cause of death in children under 5 years of age. And in our environment, obviously we know it is common. So do you want to define diarrhea? When do you say a child has diarrhea?
Okay. Yeah. Diarrhea is actually when you pass 3 or more loose stools per day. I must mention that in children, breastfeeding babies, they usually pass about 5 in a day. It necessarily doesn't mean they have diarrhea. So as a physician, if you are seeing a patient that has come to complain of diarrhea, you need to establish the facts that the child is not being breastfed presently.
Okay. So 3 or more loose stool. When you say loose stool, watery?
Watery, yeah.
So per day. So what is the because you are a practitioner, a general practitioner, so I believe you come across these ones, okay? Yeah. So what is the most common cause of regular diarrhea in children?
Yeah, in children, the most common cause is viral infection, as a result of viral infection. The most notable one is rotavirus. But you can talk of something like novovirus, and the most notable is rotavirus.
Okay, so what are the causes?
Causes of other causes. Then you have bacterial causes. Like about some months ago, we had an outbreak of cholera.
Exactly.
So that's the kind of bacterial causes. You can also have from food poisoning, from Salmonella typhi, from Staphylococcus, food poisoning, Clostridium. So those ones, they are from bacterial causes. Malaria too can give diarrhea in children mostly. Then we should not forget what we call these osmotic diarrhea, sort of, as a result of children taking sweetie juice and
okay, like fizzy drinks.
Yeah, exactly. So that one too can give diarrhea.
Really?
In children, yes.
Fizzy drinks?
Yes, yeah.
So is it the drink or the amount they take Because we need to also distinguish,
that's
is it that is it the drink itself or the quantity
Yes.
or the type? You know, there are just different factors here.
When we are talking of children, they will actually want to reduce the quantity, and even if we are giving the quantity, we still want to dilute it. Because we have said it's osmotic diarrhea.
Okay.
So,
So it does be in moderation.
So we still want to, yes, we just
encourage more fluid and water rather.
So, yeah, we still need to dilute it when it comes to children, whatever amount we are given, except if you are using it for treatment, for therapy.
Okay.
You know, some children will not tolerate ORS.
Yeah, you are right.
Otherwise, maybe we want to use, well, I don't want to sell any.
Let's
no problem. So what are the symptoms? You know, now we are talking about diarrhea in children, and I'm kind of, you know, a bit worried. Why? Because you can just lose a child with a blink.
Yeah.
Just open and close your eyes, the child is gone because of the small body mass and all that. And once a child presents with diarrhea, it's like the whole family is in chaos. Yeah. So what are those things that they present?
Enlightened ones.
Yes, we are right though.
Oh, the enlightened ones.
So what do they present? Because as a general practitioner, you are the first point of call. Doctor is in this hospital, let us rush there. So what are those things that they present? You can say, okay, this is diarrhea. And this is the one that needs emergency. This is the one that we should do X, Y, Z for. Yeah.
Like we said, 3 or more loose stools. Okay. Most times the parents will come and tell you, my daughter, my son has had 3 or more loose stools. In some cases, the child is already getting weak, depending on how it started and when it started. And before presentation, the child is already getting weak, that you can see from the child. By the time you examine the child, if you are lucky, the child is not listless, then you find that the child has dried mucosa, dried lips, you know. Even when the child cries, the tears are not coming out readily as they should. For the neonates and the infants, sometimes you can get to the stage that the fontanelle will get sunken, the high balls too.
Timson, which is what one is fontanelle for our viewers.
Actually, it's the junction of the bones of the skull.
Okay.
So let's know. We have 2, one at the anterior and the posterior.
Okay, you were talking about the causes of diarrhea.
Yeah.
Before you go to the symptoms, I'm going to ask you 2 points questions. Before you talk about the symptoms, I want you to talk about the types or the classification before you now decide that the child has severe diarrhea. No. I'm sure you understand the classification.
Like different types of,
how you will know, because you have to examine this patient before you say, is it acute or chronic, with the presence of the skin turgor.
Well, when you talk about diarrhea classification, maybe we're having 2 types of classification. Okay. Because we can have watery diarrhea alone. Okay. Then we can have mucus and blood. Okay. With it, the stool. Okay. That's one type of classification. Okay. Then we go to the second classification, which has to do with the level of hydration of the body. Good. That's when we talk about mild, moderate, and severe dehydration. Okay. For the mild, you can just ask the child might just have dried lips and dry skin in some cases. If it's the child that can talk, open your tongue. The tongue is just dry. Then by the time you are going to the moderate, the child is already feeling weak, like I said, and the eyes are sunken. Okay. We get to the severe stage.
The skin to go can still go up. And
the elasticity is almost.
But for the severe?
For the severe, the sunkenness is even more. Sometimes the child is very prostrated, cannot even sit or stand on his or her own. In some cases, you find them shouting, they are thirsty. Yes. Very thirsty, very thirsty. They need to really drink water. If you are lucky, the child has not really gone into unconsciousness, coma state or something, then you can find the child talking to you that is.
Okay. So now let's talk about the symptoms. How do they usually present with? The symptoms. Talking about the symptoms, like for children that they can't, the abdominal cramp. How will you be able to recognize that? Is it the way they move?
They are irritable. the child becomes highly irritable, crying. In some cases, they don't even tolerate food again. They don't take food from you. A very active child becomes very...
This is where we use the word irritable. And not consolable.
Thank you very much.
Irritable and not consolable. So let's quickly go to the treatment options. How do you manage diarrhea in children? But starting from the home.
The home front. Yes, from the home front, usually you can start with a salt sugar solution. This is Africa. Maybe I should go down to maybe if you have coconut water, or sometimes maybe if you don't have salt at home or sugar at home, there is coconut that's already available.
Coconut water.
Coconut water.
Okay.
You can use.
Awesome.
Yeah, we can use our ordinary soft drinks.
Okay.
Yes, especially the bland ones.
Okay.
Okay, you can use that. Then you add some little bit of salt into it.
Okay.
Then if you have ORS, that's even a very good one. Like we'll mix the ORS and give to the child. You continue to give to the child as frequent as possible. If you prepare ORS, you expect the child to finish the preparation in 24 hours. Should in case that doesn't happen, you should discard whatever is remaining and prepare a fresh one. So that's what we are trying to say. But in case you have done all that, even after that, it's still advisable you still visit a healthcare facility
to know why
the child has diarrhea. Of course, as the doctor will do the needful, maybe taking some samples of the stool for laboratory investigations and after the normal physical examination and everything. If the child desires to be rehydrated, as in IV fluids and everything, the doctor will go ahead to do that. And if, like we have said, if if we know the causative organism of the diarrhea, we go ahead to treat. If we need to use antibiotics, we use antibiotics. If we need to use, because sometimes diarrhea too can be caused by parasites. We have helminths there, mutiasis, which can also be a cause of diarrhea. We go ahead to do that. You can have some fungi too causing diarrhea.
Okay.
So we do that.
Okay.
But in some cases, we may go beyond ordinary laboratory tests for some diarrhea. Well, in that case, we are already talking about chronic diarrhea. Because somebody that has celiac disease, you have all these inflammatory bowel diseases that also cause diarrhea in children. So malabsorption syndrome is another one there. So in such cases, we need to do more laboratory investigations and more assessments. You may even need to admit the child into the hospital. Okay.
So you talked about some other investigation that is done, that is necessary. And you made mention of the ORT.
Yeah.
Okay, for children, okay? Adults also use it.
Yeah.
And we now have the sachet available. For the purpose of those that at night, midnight, you don't have the sachet at home.
Yeah.
How can you prepare it?
Yeah.
What are the things that you use to prepare it, and what is the quantity? How do you do it? So that we all know it's not for only children now. Every member, everyone who is breathing.
Especially for our audience, because it's good, because when we say ORS, ORT, and you don't have it in preparation, what quantity?
How do you do it? What do you know?
Yeah, funny enough, we have several schools of thought on this issue now. But let me go by the old school method, which is to a liter of water, you're expected to put 5 level teaspoons of salt and 1 level teaspoon of sugar, 5 level teaspoons of sugar and 1 level teaspoon of salt. You stir it thoroughly, then you give a liter of water.
So wherever you are, if you measure, at least the best way to measure is either you use a jug that has that 1 liter, or a bottle container that has a liter. Empty it into that container. 5 level teaspoons of sugar and
granulated. Granulated if it's granulated. If it's cube.
So it depends. If it's a cube, it's 5.
Yeah.
But if it is spoon, the level is
spoon, yes.
10 level teaspoons of sugar. Small teaspoon, 10 level teaspoons of sugar, and 1 level teaspoon of salt. But if it is a cube, it is 5 cubes.
That's why I'm talking about the different schools of thought.
Yes, and I think it's good. So for emphasis, what we are saying in the studio now is that for you to make ORT or ORS at home, 1 liter of water, that is standards.
Standards.
And if you have cubes, 5 cubes of sugar, and then salt, level teaspoon of salt. If you do not have cubes, but you have granulated sugar, 10 level teaspoon of sugar and 1 level teaspoon of salt. Mix together, make sure it is properly well dissolved, and then you can start administering to the child.
The child should drink at will.
At will.
Yeah.
At will. And each time there is a bowel movement, the child is expected to give the child.
Yes.
So that, because the reason is that the child is losing electrolytes at that time. So whatever you are giving replaces what the child is losing. So it makes the child a bit stronger.
Yeah, sorry. At the hospital setup too, we give zinc these days and probiotic.
Okay, good. I was going to say that in the because these are like home based.
Yes.
In the hospital, yes.
We give zinc these days,
probiotics.
zinc tablet and then probiotics.
Okay, but if
Especially
for
for
now
children.
we have home, we have hospital, and then that was the treatment. What then happened to untreated diarrhea?
Untreated diarrhea.
Immediate complications, short-term complications, and even long-term complications.
Yeah, we have mentioned about the different types of dehydration, which can now lead to hypovolemic shock, which can also lead to fluid and electrolyte imbalance, then giving out all the features of fluid and electrolyte imbalance. It can lead to kidney failure.
Wow, in children.
Yes, it can lead to
because of
dehydration.
So just shut down the kidneys.
Exactly. And it can also lead to the ultimate, which nobody prays for. That's death. Because if not well treated, seizure disorders, because of the loss of fluid and electrolyte.
So at what point should medical intervention be sought? When should the mother or the family take the child to hospital? Because you keep treating that child that has the diarrhea, you're giving your ORT, you're watching the child, and the child is not improving. The child still continues to pass the watery stools, and you're just watching the child getting weaker. So at what point should parents take the child to hospital instead of relying on their own thoughts? That's
homemade remedy.
Homemade remedy.
With my experience with ORS, ORT, it's a very effective method of controlling diarrhea. So by the time you start and you're taking about 50 meals, you should expect the motions to subside. So if you are not getting that, I won't advise anybody to stay at home. Just go to the hospital straight.
So 50 meals, like, please, can you quantify with this our
I don't know. Well, for the elite in our nation, we are talking of 50 cl bottle water.
Okay.
But then I learned this is not good, but unfortunately we still practice it. The sachet water is 50 cl.
Oh,
the common
it's
sachet water.
Because people it's relatable, yes. Because people are in different part of the community, so you need to just let them know. If you are here, a sachet of pure water or a bottle of 50
cl bottle water.
Okay, so prevention. What should we do differently? As families, as caregivers, even the hospital, because you can go to the hospital, a child can be in the hospital and pick diarrhea from there. So what should we start doing differently?
Generally, we all need
sanitation and water.
We all need to improve on our sanitation. If we have been doing it before, we need to do it more. But if we have not, we need to adopt more sanitary, good sanitary practices.
Yeah. For babies on bottle feeding, we need to wash our hands very well before feeding them. We also need to sterilize bottles regularly as possible. For those on breastfeeding, the mother is expected to clean the breast thoroughly before breastfeeding. Preparing the food, even for adults at home, before going to the kitchen. And also when we use the ladies or the gents, make sure we wash our hands thoroughly. When we change the baby's diapers, make sure we wash our hands thoroughly before we need to prepare their meals. When it comes to, we have talked about, also there are all these dysentery diseases, home food. How do we prepare our foods? It's better if you are not consuming your food now, we refrigerate it. Okay. And when we bring it out, we want to consume it, we make sure we warm it thoroughly so that we don't get food poisoning from all that.
Awesome. Because, you know, there's something about food poisoning. If it happens in a home and it's only you, you'll be wondering, okay, what happened to other people? Is it that they have better immunity than yourself? Sometimes it may just be that the person's immunity is already compromised, and so any little thing it can. But there's something about, they said, EBA. You know, this is for children. We say diarrhea children, but they say EBA. No, that if you make EBA, leave it overnight, it's sweeter in the morning. Yes, but we know him as a doctor, Clostridium Wecher, would have settled into. Couldn't that be because of food poisoning?
Yes, it is. It's a very...
Of course, for children.
Especially for children, because now little body mass and all that.
It's also advisable that environment. So one mistake that people also make is they bring the food from the refrigerator or from the freezer and leave it to thaw. When they warm everything, they take what they want and they put it back.
Okay.
So instead, it's always advisable if you bring the food out like that, take the portion that you will use and just return the other one. Otherwise, you can put them in the pack as you bring out. That is the one you should be able to consume.
We should wash our vegetables very
properly. Yes, vegetable, even our fruits. There was one video that I saw. They were washing fruits from the gutter.
Wow.
You know?
Let's
not even go there. Okay, so let's wash our fruits. Let's wash our hands and. Because Timson,
Kobe told us about the hand washing.
Let's go back to the. Okay, we'll talk about it. Dr. Timson, thank you so much for coming on our program. We really appreciate your time, and I will look forward to seeing you again. I also want to appreciate M1 Medical Women Association of Nigeria, Lagos State branch, for releasing you to come and talk on child diarrhea disease in children. And to our very lovely audience out there, thank you for again keeping a date with us, the physicians. Warrior Health is always our business and will always be our business. Let us not wait for when we have serious diseases or an epidemic before we do the needful. Personal hygiene is very important. Let's continue to wash our hands when necessary. Before your meal, after you use the bathroom. In those days, we used to have it even in schools. You have the where you can wash your hands outside growing up. But these days, we don't have it. So in schools, please let us begin to practice and let these children know how to have personal hygiene. Thank you so much for being part of our program. My name is Dr. Martina Agberie. Stay blessed.
Thank you, Dr. Timson, and of course, the Medical Women Association of Nigeria, Lagos State branch, for allowing you to come in. To all our amazing viewers out there, please, you've heard from Dr. Timson, diarrhea in children, it could be very dangerous. You can just blink your eye and just lose that child. So personal hygiene, home hygiene, ensuring that this child is going through this process, ORT, is important. If you want to be a part of this show, just you know what to do. Go to our website, fill the form, and you'll be right here, just like Dr. Timson. And if you know there's somebody that can also come share from her or his own experience, we also welcome you on board. Please be kind to follow us on all our various social media platforms. And if for any reason you want to know a lot about medical issues in Nigeria, in Africa, and worldwide, go to our YouTube page, subscribe, follow us there, and binge on over 300 videos that we already have there for you. Till next time, my name remains Dr. Mimuna Kadri. Remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, you train back supplement for you and me. In your body,
Diarrhoeal nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarrhoeal from LB Pharma. Diarrhoeal, love yourself.